Bondi Junction Private Hospital is a boutique surgical facility discreetly positioned in the heart of the eastern suburbs. It is fully accredited by the Australian Council of Healthcare Standards. The hospital specialises in cosmetic, facial, plastic surgery and ENT surgery, with expert staff trained in these areas. It is fully fitted out with state-of-the-art equipment. The hospital has a high nurse to patient ratio, and its discreet location ensures patient privacy. There are both private and shared rooms for day-only procedures, and overnight accommodation is available if necessary.
Hello, I'm Dr. Michael Zacharia. Thank you for taking time out to learn more about my clinic and the procedures I perform. One procedure that I do commonly perform is rhinoplasty, and this is an operation where we actually change the shape and function of the nose. Everyone presents on an individual basis. Some may have a small bump on the nose, some may have a crooked nose, some may have a large tip. So we have to make an individual decision based on what you present with as to how we can actually create the aesthetic harmony of the face. Rhinoplasty is one of the most common procedures performed, but it is very important to have someone who is skilled and knowledgeable performing the surgery for you. And with my background of ear, nose and throat surgery, I'm sure that I will be able to perform for you a rhinoplasty that matches your individual needs. It's important that we look at the combination of not only the nose, but how the nose blends into other parts of the face, including the cheeks and the chin. So sometimes we combine cosmetic procedures which are surgical and non-surgical to achieve the best outcome. So by the time you finish your consultation with me, you should have a very strong understanding about the type of surgery that we're going to perform and what your outcome will be. So thank you for watching this presentation. I am committed to providing you with the best of patient care, advice and support, and look forward to looking after all your cosmetic needs. Well, thank you for coming in, Byron.
My pleasure.
Tell me how I can help you. I believe it's your nose that you wanted to talk about today.
It is. From the side, for my profile, you see quite a big lump in the middle of the nose, and from the front on, it veers to the right and then also veers down to the left, and so I just like that to be like straightened and more refined.
Okay, and tell me, do you have any problems breathing through the nose?
No, I don't.
And no problems with your sense of smell?
No.
Good, okay. You can see by your nose that you have a bump on it which is made of both bone and cartilage, and certainly that is causing the crookedness as well. And so those two things can be corrected by surgery. The surgery is performed by little cuts on the inside of the nose, and then we get access to the cartilage, etc., and make the changes like that. Do you have any questions about the surgery?
It would be more about the appearance. Will it be quite natural, or will it look as though I've had it done?
Absolutely natural. I think the most important thing about any surgical procedure is to make sure that it's natural looking. And we can do that by having an idea with a computer imaging.
And how much swelling and bruising will I have?
We're using very small instruments, so usually we don't get too much bruising, but usually it's just swelling around the eyes only. That will last for around about a week to 10 days. We have a plaster on the nose, and that will stay on for around about a week to 10 days as well. So when can you go back to work? Probably after 2 weeks.
So will you be making any cuts from the outside of my nose?
No, in your case, I'll be performing some surgery through incisions on the inside of the nose only. Sometimes we do have to perform external incisions, but in your case this won't be necessary. So why don't I show you this on the computer, and then we can get a real idea about exactly what we can achieve for you.
That'd be great.
Okay. On the front-on photo here, you can see that the bone and cartilage is a little bit bent. Now we can do some imaging on here using little tools, and you don't see that much of a change from the front. So with the front on, if you look at that photograph again, you can just see some very mild changes to the shape. But certainly when we look at the side view, this is where we see a significant change. We can take this down, and from memory you want just basically a straight nose, so it's important to keep it straight and natural. What I'm going to do is put the changes right next to each other. And again, looking at this image here, what do you think of that?
It's a very big difference.
Okay. So I think the surgery for you is going to be quite straightforward, and I think that we should be able to achieve a very nice, natural outcome that's going to be very similar to what you've seen on the computer imaging.
That's fantastic.
Okay, well, I look forward to performing the surgery.
Thank you.
Okay. Okay, so Byron, it's been 4 weeks since the time of surgery. How's your recovery been?
I prepared myself for the worst and I didn't get that, so it was about 3 days of just lying on the couch and watching DVDs, but other than that I was fine.
And so tell me about the reaction of other people and what you felt about the surgery.
I've had so much positive feedback. The result is so natural and everybody's ecstatic with it, and so am I.
That's good. You had some problems with the breathing beforehand and we fixed that problem up. And so since the surgery, how's your breathing been?
For breathing, for about the first week was kind of difficult. I felt really blocked up as though I had like a really bad cold. But once the splints came out, then that was all fine. I actually could breathe better than what I could before.
That's good. And you know, at the time of the surgery, we took down the bump of the nose. We broke the bones to bring in the nose as well. We did some work on the tip cartilages just to again narrow it slightly, and then we also improved the breathing on the inside. And at the end of that we sprayed the tissue glue to decrease the swelling. So at this point in time, only 4 weeks out, it's very early in the piece and it's looking fantastic, but soon over the next 3 months it's going to look more like what we saw in the computer imaging. So I think what we'll do is we'll get you back in 3 months' time, check it out again, and if you have any problems you can come back sooner.
Perfect.
We'll see you then.